Welcome to Chillin' 101. We hope this video helps.
You have batteries inserted and the probe cleaned. Now power the thermometer. You start by pressing the power button until the display lights and you hear the initial beep. Once done, confirm the unit shows a ready icon or 0/degrees C. Make sure the probe tip is dry and the mode is set to body if there is a mode selector. This step matters because cold probes and wrong modes produce incorrect results and waste time repeating measurements. Once the device is ready, choose the correct measurement type and position the probe precisely. For oral use, place under the tongue toward the back. For axillary, position high and close to skin. For ear, angle gently and form a seal. Hold the probe steadily, do not talk or move so sensors can stabilize. After the timer or beep, read the display immediately. This reduces variability and ensures the thermometer averages temperature correctly, instead of giving transient spikes or low values. After reading, switch the thermometer off and record the value and time for tracking. If you use disposable probe covers, discard them, otherwise sanitize with alcohol and let dry. Remember that readings above 38 degrees C or 100. 4 degrees F typically indicate fever and warrant medical guidance. If the display shows error codes, inconsistent numbers, or no response, replace the batteries first, then re-clean and reposition the probe. If problems persist, consult the manual or support. This troubleshooting fixes the most common faults quickly.
Thanks for watching. Consider subscribing if we helped you.